1 in 6 people around the world struggles with infertility, a condition that prevents a couple from having children. According to the World Health Organization, infertility does not discriminate between high, middle, or low-income countries. In fact, in Nigeria, Africa's most populous country, some experts suggest 1 in 4 people are unable to have children. So, some opt for surrogacy, where another person carries the pregnancy for them. A decade ago, this was very rare, but as DW's Amaka Okoye reports, it's now become so common that surrogacy agencies are emerging, although there are still no adequate laws guiding the procedure.
Myra and Myla are Judith's children, but she wasn't pregnant with them, and she didn't give birth. They were carried and born by a surrogate. Judith has the autoimmune disease lupus, which means she couldn't carry a baby to term. She decided to find a surrogate to have her babies for her. She tells me that it wasn't simple for her.
It wasn't a direct process because surrogates are human beings. We had agreements, yes, but they are human beings and they can break agreements. And so the first, second, even the third surrogate broke agreements. Breaking agreements like she will start the process and midway, I don't want to do this except you do this for me. It was a tough period.
Judith found a surrogate who successfully bore her children, and she turned her experience into a business. She now runs a surrogacy agency. The full service cost the parents around 3 million naira, or 6,000 euros. After medical costs and the agency fee, a surrogate can expect to get about half of that. That's around 3.5 years of minimum wage. This woman is pregnant with someone else's twins babies. It is her second surrogate pregnancy. She knows all about the hormone medication that is needed for an implanted pregnancy and the worry about whether it will work. She asked us not to identify her.
Turn the pure water. You know, when you start the medication, you have to leave any work you're doing at hand at that point. So it's 50-50. It's either you gain or you lose. And when someone loses, it's really bad. So one just needs to be prayerful that, God, I want this thing to be positive so that I won't just waste my time. And after you get positive, like maybe 2-3 months, you still have to be careful too because you can still lose it if someone is not careful. So that part is scary.
How does she think she will feel when she has the babies and gives them to the parents?
Actually, one is not my egg. See, it's not my sperm. I'm just a carrier. I have my own children. That is why I can't do this body adoption. I can't do it because it is mine and I can't afford to lose my own child. But in this case, I'm just a carrier. It is not my child.
If you look for a surrogacy law in Nigeria, this is what you find. There isn't one. Currently, parents, surrogates, and agencies use contract law. Judith says she would like to see a smoother, better regulated system so everyone involved has more certainty. She wants to help others who have struggled with infertility have the children they want, like she does.
So, surrogacy is clearly not an easy procedure. What makes it even more complicated in Nigeria is that there is no clear legal framework guiding the process. So how much of a challenge is that? I asked Chinenye Ibeneme, a commercial lawyer in Abuja.
Well, it's going to pose a very big challenge because right now, from what I understand, people personally enter into personal contracts, on this issue of surrogacy, either for altruistic reasons or for commercial reasons. Now, because there's no specific guiding law on this issue, it's prone to abuse. I'm sure you must have heard of baby factories across Nigeria, where hospitals, maternity homes are complicit on this issue. So there's a kind of a black market right now. And because it's open to just individuals, the surrogates and the birth mother, there's a lot of abuse might come in. There's no capping of because the law does not provide for this issue. Teenage girls, underage girls might be exploited. People from disadvantaged communities might be exploited for financial reasons.
So, I mean, it sounds very serious that this whole situation could be abused. Why is the government trying to do anything about it? Why is there no particular law for surrogacy?
Nigeria, we're very, very traditional country, and a lot of issues are not up in the front burner, especially things that are issue like assisted reproduction. It's still something that a lot of people don't want to talk about. It's just in the past 5-6 years that things like IVF gained wide acceptance. Now, in Nigeria here, because of cultural, religious, traditional norms, most women would want to be the one to carry their children to full term. Yes.
Yeah, I mean, I think you've made that point clear. Back to the type of contract, though, because this is the issue. You're talking about the black market side of it, but there's also, I don't know if we can say white market or the legal, so to speak, market of it, where people openly are saying, yeah, this is an agency where, just like the report we saw, they're saying this is an agency where, if you're struggling to have a kid, you can come and we can provide you with a surrogate mother, so to speak. So it seems it's also being done in the open. How do you juxtapose the legalities between that and the black market situation?
Okay, now, if they have to enter into contractual terms, between maybe, like you mentioned, there's a surrogate agencies that handle these issues. Now, those contracts will be subject to the laws of contracts, governing contracts. Now, personal contracts between individuals. Now, we have to look at if there was no misrepresentation of material facts by either of the parties, either the surrogate mother or the woman that is being assisted. All facts, material facts on that issue must be presented. Also, there must not be duress. The surrogate mother shouldn't be enticed or under duress to accept to be a surrogate. If the contract was entered under duress, now it's voidable under our Nigerian laws. So if you have a child of less than 18 years agreeing to be a surrogate mother, the contract is voidable. In fact, it's null and void ab initio. So there are a lot of factors that must be looked at, legal issues that must be looked into while examining such surrogate contracts.
Okay, clearly a lot of issues need to be ironed out if such a law is to exist. Chinenye Ebeneme, lawyer in Abuja. Thank you very much for your time.
Thank you very much.
Now, the option of fertility treatment is also complicated and expensive in Africa and beyond, adding to the distress and stigma that the affected people already face. I discussed this with Priye Fiebai, the president of the Association for Fertility and Reproductive Health in Nigeria. He starts by telling us the state of infertility in Africa's most populous country.
It's the most common reason for gynecological consultations in most of our clinics, and the prevalence or the incidence rather appears to be increasing recently, as we're seeing many more people complaining of inability to conceive.
I mean, that has my attention. Why does it seem that more and more people are suffering from infertility?
Well, maybe because awareness is better. Unfortunately, most of the data we have is based on hospital surveys. And a lot of the clients who go to clinics outside where research is done are not captured. So we have a lot of people. The health system is divided into two main sectors. That's the formal health system, private and public. Most of the government hospitals attend to those that are reported, but we have a large number of private facilities who probably cater for even more than the patients that we see in government hospitals. And most of the data from their facilities is not reported. However, we are recently trying to carry out a nationwide survey so that we have a better understanding of the prevalence of infertility.
Yeah, definitely it sounds like a challenge. Now, when it comes to infertility, basically meaning not being able to have kids, many point fingers at the woman. But as we know, and as you said a bit earlier, men can also be infertile. Isn't that right?
Absolutely right. Absolutely. And it's not just men can also be infertile. In our experience, generally, about 30% of cases are due to factors in the woman, another 30% due to factors in the man, and then we have about 20% where you have combination of factors in both the man and the woman, and then for about 10%, both they are termed as unexplained subfertility, because we really can't pinpoint a finger on what may be causing the problem in the couple. So men and women in our environment contribute equally to the causation of infertility.
What are some of the practical things that one can do to increase chances of having kids?
So we start from those who have not yet commenced the process, and we advise preventive measures before you even start trying. Good diet, healthy lifestyle, exercise, avoid multiple sexual partners, avoid tobacco and alcohol as much as you can. And that way you reduce the risks that you encounter. And then for those who initiate the process and have started trying, don't wait for too long. If you notice that there's a problem, you should seek appropriate medical care early. So simple methods like ovulation induction can be carried out by general practitioners and anyone that is trained to do so. But when it starts becoming complicated, it will be wise to see a gynecologist, and if need be, a fertility specialist, so that will guide you appropriately, evaluate you, and give you the appropriate treatment that would assist in getting you pregnant.
Dr. Priya Fibai, President of the Association for Fertility and Reproductive Health in Nigeria, thank you.